Hi, hello, good evening, everyone. Welcome back to iMumz Ask Me Anything session. So today is the 94th session of Ask Me Anything by iMumz, and today we have Dr. Chinmayee Ratha from Hyderabad with us. Welcome, Dr. Chinmayee ji.
Hello, Ravi.
Yeah.
Hello,
So
everybody.
yeah, thank you for joining us, madam. So let me quickly introduce Dr. Chinmayee ji to all of you. Dr. Chinmayee ji is a very senior obstetrician, gynecologist, and also a practicing fetal medicine expert from Hyderabad, as I told you. She has an experience of more than 20 years, and she's associated with Yashoda and Navoyada Hospitals in Hyderabad as a gynecologist, obstetrician, and fetal medicine expert. She's also a researcher, published more than 14 research papers in prestigious journals, and most importantly, she's loved by all her all the pregnant women who are consulting her for her charming and positive words. So in the iMumz app also, she has she shared many interesting insights on few topics. You can check them out also. So let's not waste the time. Today she is going to speak about multiple pregnancy, that is how to take care of your twin or triplet pregnancy, and what you should be remembering in this time. So please, doctor, please carry on with this topic, and she will take all the questions after that. So please post your questions in the comment section, and over to you, Dr. Chinmayee ji.
Thank you. Thank you so much, Ravi. And I think it's wonderful to have this kind of an app which allows you an interaction with a doctor regarding all your queries in pregnancy. And I've been trying to navigate through that app and seeing that a lot of information is available there regarding common pregnancy problems. And all of you can go through that. I'm sure you must be going through that. Looking at the number of questions that have already come up, I'm so glad that lots of people are using the app regularly. Now, we are supposed to have this session on multiple pregnancy. The questions that I have seen so far are not particularly on multiple pregnancy, but we'll definitely address that. But since the session was planned on multiple pregnancy, let me just give you a little insight into that. Most of the times we consider that pregnancy means a mother and a fetus. So we assume that there is just one fetus inside the mother's womb. And that's how most pregnancies are. However, in a small number of pregnancies, and that number is becoming bigger by the day, mind you, in a small percentage of pregnancies, you may have more than one fetus in the uterus, so that a woman may be carrying what is known as a twin pregnancy or sometimes a triplet pregnancy when there are three fetuses. And nowadays, sometimes we also come across pregnancies where there are 4 or 5 fetuses. So, multiple pregnancy is becoming a clinical entity. And sometimes it leads to a lot of worry in the early pregnancy when a woman comes to know that she has more than one babies inside. Twin pregnancies generally are very welcome, and people feel very happy about getting twin pregnancies. It's kind of a very glamorized thing also, so they feel very excited. But sometimes the twin pregnancies may come with complications when there is only one placenta, or if there are a difference in the size of the babies, or there are some complications which come in with twin pregnancies. So anybody who is carrying twin pregnancies must have a very detailed early pregnancy evaluation at a center which has a good imaging person or a fetal medicine specialist, and they should make sure that the babies have 2 placentas or 1 placenta, that chorionicity, what it is called, the number of placenta has have got defined. And they should also get a plan for that pregnancy, that when they need to come for regular checkups, what are the expected complications. Sometimes both babies may not be growing appropriately. There may be a disparity in growth. There may be a disparity in the formation of the two babies. And these problems, if they occur, how can they be managed? Fortunately, science and technology has advanced to the degree that we can manage all these problems, but they need to be identified and sent to the correct center well in time. The other important thing about multiple pregnancy is that the woman has to be very careful about her own health, and all the pregnancy symptoms that are seen in pregnancy, like nausea, vomiting, general discomfort, pain in abdomen, they all get aggravated because there are more than one babies inside, and the pressure on the pregnancy itself is large. Nausea and vomiting is more because there's more placental surface, there's more chemical hormones being produced. So a woman has to be mentally prepared that these symptoms will be a little more exaggerated. I will be having two babies, so I'll be having a little more discomfort in pregnancy. But that needs to be known and addressed as it is possible. The other important thing is sometimes because you have more than one baby in the uterus, you may actually land up in a stage of delivery before the expected time, what is known as preterm birth. Term birth is when the babies are completely ready for being delivered, and preterm is when they are still not completely ready. They still have to mature a little bit more. But because the uterus was so over distended, you land up in what is called preterm labor and you deliver your babies before time. So there are methods of predicting this, the risk of preterm labor. There are methods of arresting preterm labor, and there are methods of optimizing the delivery of the baby in case labor cannot be arrested and we have to land up in a preterm birth. And it requires a close coordination of your pregnancy doctor along with the newborn baby doctor and all other facilities. So that is also something for which you should have regular follow up in pregnancy. Some complications of pregnancy, like gestational diabetes and hypertension, can be more aggravated in women who are carrying multiple pregnancies. Sometimes when you don't feel up to it, like you have triplets and you feel you just cannot manage all the three babies at the same time, it's a huge thing to have, and there's a huge risk of preterm labor. There can be some procedures like selective fetal reduction, which is done to optimize the number of fetuses. So if you have quadruplets, pentuplets, 4 or 5 fetuses, they can be brought down to 2 fetuses so that you can continue as a twin pregnancy, because the outcomes of twin pregnancies are pretty good, and they are very manageable from the clinical point of view. So, having said all that, it's not all problems and panics. Multiple pregnancy is a very joyful condition, and some patients who have had twins and even triplets and continued till full term, they have the luxury of having three children of the same age all their life, who can always interact with each other. They're ready-made friends for life, and it's very satisfying at the end of the day. So very hard, and a lot of hard work also. The other thing you need to be mentally prepared when you have multiple pregnancy is help at home, because as soon as you deliver the baby, the obstetrician's job is done. We are very happy that we've taken you to 9 months and given you your babies at 2 or 3 kgs, and everything is done. But when you take them home, you have to cater for each one of them, and that's a lot of work. And a woman can really get tired and sometimes even overwhelmed if she doesn't have enough support at home. So when you're carrying multiple pregnancy, please make sure that you have arranged for enough help helping hands at home, so that you can manage the newborn period, and then the infancy period in a good way. And thereafter, when everything goes well, multiple pregnancy is multiple pleasure, because uh, your family is suddenly expanded into more number of members, and the children get a very good peer group to interact with all the time. So I think multiple pregnancy is very manageable. And if you have any queries regarding multiple pregnancy, please feel free to ask me. And mm, while we wait for queries on multiple pregnancy, there are some questions which have already come onto the chat box, and we'll take them one by one. Meena M has asked that I want to know if normal delivery is possible while having diabetes. I am 31 weeks pregnant and diabetic. The recent report of my HbA1c is 4.8. I'm on insulin and my blood is 9.9. This I'm assuming your hemoglobin is 9.9. 9.9 is a bit low, isn't it? So I suggest that you get a test called HPLC and check that you do not have any hemoglobinopathy, and then you check with your doctor with that report as to how to improve your hemoglobin, because that is very, very important. Diabetes is one aspect, but hemoglobin is an extremely important aspect of your care in pregnancy. Now, your HbA1c is 4.8, which is kind of good control. HbA1c is glycosylated hemoglobin, and it tells us the trend of your sugar control over the last 3 months. And this looks to be pretty good. You're 31 weeks, and that's a good achievement by your doctor and your endocrinologist. You are on insulin, you're controlling your sugars. So, really, if the baby's growth is appropriate, you can be a candidate for normal delivery. But you must understand that normal delivery or cesarean delivery would be a decision taken at the time of deciding your birth, and many factors come into play there. Women who have diabetes have a tendency of having babies who are bigger. That's more common with uncontrolled diabetes. And if the baby is bigger, and the babies also, they're bigger in a way that their shoulders are very bulky. So there can be problems like shoulder dystocia during normal delivery. And all this assessment can be done when exactly delivery is being planned. What is the estimated fetal weight of that baby? How is it placed in your womb? And how are your movements? How are the Dopplers? How are other things? So that's a composite factors which are going to be assessed by your doctor at the time of your labor. And then she will take a call on whether it is safe to allow you for a vaginal delivery, or whether it's very unsafe and you therefore need a cesarean delivery. So I cannot tell you from now whether you can definitely have a normal delivery, but if you don't have any other risk factors, if you don't have a previous cesarean section, if you don't have a very big baby, if you don't have a low lying placenta, if you don't have less fluid, if you don't have abnormal Dopplers, then you know one on the other, these causes have to be ruled out, and then you are a candidate for vaginal delivery under extremely strict feto-maternal surveillance. So you will need fetal monitoring throughout labor, and at any stage where the doctor feels that things are not going right, probably you will end up having a cesarean section. So that's how it will go. Now,
Thank you.
yes,
Doctor, can I
Ravi?
ask question from the app also? Like, there is a
Okay,
question.
yeah.
So I'm taking in the order of timestamp. So next question we have from Isha. She's 10 weeks pregnant. She's having a lot of heartburn this week. Is there any home remedy? Also, she's feeling like having only sweet food. Is this okay?
Sorry, is this okay? Is what she's asking? Okay. So, Isha, heartburn is a very, very common symptom of pregnancy, and moreover, early pregnancy. What happens in pregnancy is there's a hormone that's released that's called progesterone, and this is a very this hormone protects your pregnancy, and it relaxes a lot of muscles and sphincters in your body. So the lower esophageal sphincter, or the food pipe, the lower sphincter of the food pipe which connects to the stomach, also gets very relaxed, and therefore the acid in the stomach can regurgitate. One of the best methods to avoid that is to have small, frequent meals, and make sure that you don't allow yourself prolonged fasting and very spicy food, things which can lead to exaggerated acidity. Apart from that, if you want some home remedy, cold milk works very well. So if you can have cold milk or even ice cream, that will give you a soothing impact at that point. So first, avoid acidity by timing your meals and avoiding spicy food. Second, cold milk works very well. And if that also does not give you any relief, then you will need to meet your doctor and get a prescription for an antacid. That will help.
Thank you, doctor. Another question we have from iMumz app. Deepa Raj is asking. She's 25 weeks pregnant. She's getting heartburn, same similar symptom.
Yeah.
Today, please
So
tell
the
me. Is
answers
there
more or
any,
less similar to her. Yeah.
yeah, but
Yeah,
she's 25
and
weeks
because she's
pregnant. She
25
can,
weeks,
yeah.
before she's 25 weeks, the other thing she needs to do is, after you have your meals, don't lie down immediately, because in pregnancy, you see, your womb is also growing and the pressure in your abdomen is very high. So if you lie down immediately after your meals, the regurgitation of the acid is much more. So try staying upright after your meals for some time. Again, avoid spicy food and cold milk. Yeah, I mean, taking cold milk will help. Okay. Can I take another question from here?
Yeah,
Shrishti
absolutely.
Bansal. Hello, ma'am. I'm 14 weeks pregnant and I have pain in lower abdomen. With my scan, placenta is lower. In case of more pain, can I take anafortan tablet? What precaution should I take? Okay, Shrishti, first and foremost, any pain in pregnancy, do not take any medication without checking with your doctor. And most of the painkillers are not safe in pregnancy because they act on certain areas of the body that also are linked to the fetal tissues, and therefore they can be damaging to the fetal kidneys and other organs. So no taking medications on your own. uh, Low lying placenta by definition does not cause pain, so that cannot be the cause of your pain. And when you say low placenta in 14 weeks, again, you have to wait till about 6 months or 8 months. The placenta might just move up, so that's not a big deal. What kind of lower abdominal pain you are having is very important. If it is crampy pain, then you need to see a doctor who will check the length of the cervix, the neck of the womb. If that is getting shorter or you are getting cramps, then that needs a different kind of treatment. So please don't do self medication. And if you want to meet your doctor with all possible investigations, you also get a urine examination done. Very often you are having urine infection and that is manifesting as pain. Sometimes you have constipation that is manifesting as pain, and sometimes you really can't define that pain. It is better to go and have a check. The ultrasound saying that the placenta is low lying cannot be the cause of your lower abdominal pain. What happens if sugars go high while delivery or near to EDD? Well, you need better control. So you're already on insulin, Meena, and your sugars will be controlled by your insulin doses. So if it goes high, it has to be put your dose of insulin has to be increased. Jhansi, AFI level 18 is normal at 28 weeks. Your doctor would have given you a graph. So for every stage of pregnancy, the amniotic fluid index is measured, and the general range is between 5 to 25. So anything between 5 to 25 is considered normal, but for every gestational age, there is a graph. So when they draw the graph, they will tell you. So I think what's important is what has the doctor reported. So if the doctor has put it on a graph and reported as high, then you need to work on it. If the doctor's reported normal, then that should be there. Baby weight 1.3, heartbeat 169, and BP 140 by 90. See, it all depends on what stage of pregnancy you are, how the thing. 1.3 kg looks to be okay for 28 weeks, but I would prefer seeing the graph. So if they have seen the graph in your exact gestational age, how that has been calculated. So, giving a ballpark figure and just saying that whether it's normal or abnormal is not justified. Looks to be within normal range, but it's always better to see your exact report. How many days will the implantation bleeding last and how to differentiate it, and also when implantation bleeding should I do test? Um, Well, it's different for different people, and everybody doesn't even have an implantation bleeding. So you stick to the basic rules whenever you are expecting your next period. If you don't get a period on the expected date, then you wait for a couple of days and get the urine pregnancy test done. If the urine pregnancy test comes positive, then you can have a scan after, say, 10 days of that and make sure that there is a sac, which is intrauterine, and things are good. And if you have problems locating the baby on the scan, then do a beta hCG level and see how things are going, and meet your doctor for a specific solution. Thank you, Shanti. My question is, I'm using 150 micrograms of Thyronorm as I have thyroid, and I am now 18 weeks pregnant. Can I continue the same dosage or I should increase? No, you should not change it on your own. When whoever has advised you the 150 micrograms, they would have done it based on a report of your thyroid function test. And if you're taking 150 micrograms and things are normal, they would have made sure that it's normal. Check it after 3 months. So every 3 months, get your thyroid function test done. And if the thyroid function test is good, is normal, then you can continue on the same you can continue on the uh, same dose. If there is a problem with the thyroid function test, then you need to change the dose, but that has to be done in conjunction with your doctor. You should not change it on your own. Saurabh Agarwal, I am 26th week pregnant. I feel very heavy in the lower abdomen. Yes, you can feel very heavy in the lower abdomen. Your lower abdomen is getting heavier. So that is definitely expected at this stage, that the lower abdomen will get heavier. Just a minute. So what you need to do is you need to modify your posture. So, if you're sitting in a ergonomically wrong posture, the effects of that pressure will be much higher. So give yourself good back support, sit straight with your spine, don't slouch. And when you sleep on your bed, also make arrangements. There are nice comfortable pillows available in pregnancy, which allows you to sleep
Hi everyone. I think we had some technical connectivity issue from doctor side. We're waiting for next 2-3 minutes to for Dr. Chinmayee ji to join. Yeah, hi Sneha ji. Dr. Chinmayee ji will answer your question soon. We're waiting for Dr. Chinmayee ji to connect again with us. And yeah, I think Dr. Chinmayee ji is back again. Hi,
yeah,
doctor.
what happened? Yeah.
I think there might be some connectivity issue. Yeah, please
Okay.
proceed, doctor.
I'm sorry for this thing. And I was talking to, I think, Saurabh Agarwal, and we were discussing about being heavy in the lower abdomen. So, as I said, try your postural changes, try comforting yourself with pillows while you sleep. But if it persists, then get your cervical length checked so that that's not getting shorter and there is no other reason to get worried. Then we have which food can I eat for baby weight? Well, high protein diet is good. So make sure that you have enough proteins. And if you're a vegetarian, you get proteins from dal and paneer, milk products, uh, soya bean. These are the sources of protein for vegetarians. For non-vegetarians, eggs and meat products. Uh, all meat is not very good in pregnancy, so stick to the like non-red meat, the lean meat, where you can get less of fat and more of protein. And any meat that you eat in pregnancy should be very well cooked, because raw meat can cause a lot of infections which can affect the baby. So well cooked meat is also a good source of protein. Harsha says, I'm 34 weeks pregnant. I'm having little fever and cold, no body pain. Feeling less energetic. Please advise medicine. I am taking warm water regularly. Well, Harsha, I don't know which part of the country you are in, but be a bit careful. If you have fever in today's day and age, we really need to work up the reasons first and foremost. But you don't have any body pains and any other symptoms, which is good. You're taking warm water, that is also good. For a little fever, you can take tablet paracetamol 500 milligrams, maximum 3 times a day is okay in pregnancy. But do not neglect the symptom on your own. It is better to see a doctor and get yourself evaluated. So if it is a mild viral, if it is something which will just go away after a day or two, then that's fine. But if it does not and it's persisting and creating trouble, it is better to meet a doctor and check. So warm waters are fine. You can take steam inhalation, you can do gargling with warm water. If all that doesn't help, then please meet a doctor. Or if there's any shortness of breath or any symptom which you feel that you're worried, at least in these times, I would suggest that you meet the doctor and get yourself checked. I am 5 months pregnant. I have loose motions many times. What do we do to avoid this problem? Now, it depends. I mean, how does it start? Has it always been a problem with you, or if it is a symptom that has started new? And if it has started new, check what is the iron preparation you're taking. Many women have a reaction to the iron supplements that they are taking, and that may be causing a problem. So alter your iron supplements or stop your iron for a day or two and see if that gets better. That's one of the reasons. The other reason is you may be having a mild sort of stomach infection, intestine infection recently. Then what you do, try taking probiotics like curd. You've got curd, and alter your diet so that you're not taking very spicy food. Some high fiber diet, oats with curd or rice with curd. Try having that, altering your diet and seeing if this gets better. If it gets better, excellent. If it doesn't, you'll probably need to meet your doctor because they'll give you some antibiotics to stop that loose motion. It may be a stomach flu for whatever you know. And to avoid the problem, clean drinking water, clean food, and clean your hands every time you eat, and clean utensils, clean kitchen. So just cleanliness is the best way of avoiding these problems. Sometimes despite your cleanliness, it may be because of an allergy to the iron preparation, so try modifying that. Riddhi Chawla, can we apply hair color in pregnancy for gray hair? Okay, Riddhi, don't apply a new one. I mean, if you are used to that hair color and if you have used it in the past and you've done every cosmetic product comes with a patch test thing. So if you do a patch test and you know that there is no allergy that you have to that particular mm, product, I think it's fair. You can apply it, not a problem. But don't apply a new color for the first time, because if you develop an allergy or if you have a reaction to that particular thing, we can't give you any medications for alleviating that also. So that can unnecessarily cause a trouble. The other thing is, when you apply this, be extremely careful, take somebody's help, because in pregnancy as such, you have limited ability to move and do stuff. So you don't want the hair color falling on your eyes or something, which can lead to a different problem. So be careful, and under precautions, if you use it, that is fine. 5 weeks pregnant, having high TSH 4.9. Can you suggest how to control it? Well, you need to meet your endocrinologist, because he will run some tests which include the entire thyroid function, and see whether there is any need for starting a medication for thyroid. So only by proper consultation with an endocrinologist, start the medication. 4.9 is not that bad, but it needs to be addressed and it needs to be followed up. So you need to take the medication as per the advice of the endocrinologist. Why I'm telling to meet the endocrinologist? Because you don't know why you're having this, what was your trend, and how it is to be followed up. So he will give you a complete advice. And in pregnancy, thyroid levels must be managed properly. Too much fluctuation in the thyroid levels is not good. Hence, meet a doctor. How long I need to rest after a C-section? I am pregnant with twins and I'm going to have a C-section. Okay, you will not be able to rest much after the C-section, dear, because you'll have to take care of your twin babies. So if you mean by rest as in bed rest, you really don't need to be on bed rest after C-section. Sections are getting easier, and the technique for surgery has evolved much better. The technique of anesthesia is much better, and people are recovering very fast. So women after cesarean section can start actually walking after 6 to 8 hours, because they are done on the spinal anesthesia, and these women get back their motor functions pretty fast. Rest as in, we don't expect you to be doing heavy physical work like lifting buckets or washing too many clothes at the same time, not those kind of things. But you will have to nurse your children, so you will have to be active after that. For about 6 weeks is the period of puerperium, when we expect a woman to be little restricted in terms of activity and interaction, and that is the time that she gets to avoid social activity. But complete bed rest you don't need. You need to sleep about 8 hours in the night and about 2 hours in the day. And with 2 children, that may not be all possible in a complete bulk 8 hours, but sleep when the children sleep. Try to modify your routine that way. And like I said earlier, also get some help at home. If your mother or your mother-in-law can stay with you, and your sister or somebody who can just stay back and kind of support you while nursing the babies, then that will be a big help. I have very irregular periods. My LMP was on 7th May and I tested yesterday where I got negative. So you need to wait, check what is the cause of your irregular periods, and if there is a hormonal imbalance that needs to be addressed. Now, this is a problem we cannot really solve on a generalistic advice basis. So, if you still wait for a week and it doesn't happen, maintain a menstrual diary for a couple of months. See what is the kind of trend of your periods pattern, and if it continues to be irregular, meet a doctor, get your hormonal tests done, and then she will put you on medication based on your specific needs. Because suppose you have irregular periods but you're still planning your pregnancy, you need a different kind of treatment. Suppose you're on irregular period and you don't want pregnancy, you want contraception, then you have a different kind of treatment. So you need to see a doctor, Shruti. Sneha says my AMH is 0.04. Well, you'll have to see a fertility specialist for that, because that is not specifically the content we're discussing now, and that needs very, very concerted workup in a fertility clinic. I think Jaideep ma'am will be able to answer that better for you, and I'm sure they'll put you through. You are having some uh, messages about how you can contact her, so get in touch with her and she will solve that problem for you. I am 22 weeks pregnant with dichorionic diamniotic twins. I am suffering from hypothyroidism. I am taking 150 micrograms. During 13th week of pregnancy, I went for fetal reduction. So I'm assuming you had triplets, and you had fetal reduction, and now you have dichorionic diamniotic twin pregnancy. So that is fine. If you are already on treatment for your hypothyroidism, then the outcomes are going to be very good, because thyroid problem is important, but the treatment is also quite simple. You just have to pop in the tablet every day morning, empty stomach, and if your thyroid levels are controlled, then the outcomes are going to be very good. So I think you should be reassured, and I wish you well, and work hard to keep yourself healthy and fit to take care of your twins. Then I'm 32 weeks pregnant. My doctor prescribed me Neo HP and Amacy when I was 24 weeks pregnant. Shall I continue these tablets? Jayalalitha, I am not sure. These are trade names of medications, and I am not sure what they stand for exactly. But if your doctor, whenever you go to a doctor and you get a prescription, you have to take a clear instruction from the doctor at that point, because when the doctor prescribes you, I suppose these are supplements, and if these are supplements, most of the supplements we ask them to continue through pregnancy. But if a doctor has given you a particular supplement, say vitamin D, for a given period of time, she will specify it. And then you ask her that, Madam, after this time, suppose I don't get to meet you, what should I do? Should I continue or should I stop? Because I have seen women who stop their iron and calcium because the doctor wrote for a month and they could not go to the doctor the next month. And then they come the third month saying that, oh, we stopped the medicine because she had written for a month. But iron, calcium, protein, we tend to continue throughout the pregnancy, and therefore that is important. See, Neo HB looks like a preparation to improve your hemoglobin. Amacy, I'm not sure. I'm sorry, I don't know the trade name. So what I would suggest is check with your doctor, because it's 8 weeks, and you should have had some contact with your doctor, and check with her what were these medications for. If they are iron and calcium, they need to be continued throughout pregnancy. But if they are some other protein, hormone preparations or anything else, then there is a timeline for that. So please check with your doctor. Now my twins have anterior and posterior placenta. Please suggest what kind of exercise I can do, as my BMI is 32. Well, your BMI at this moment is not to be addressed with exercise, because your BMI right now is a calculation with your weight, which includes your baby's weights. Okay, so you don't have to do an exercise to optimize your BMI at this stage. The reason you will do exercise is to avoid back pain and uh, pressure problems in pregnancy. Now, there is, if you look into this app of iMumz, there are areas where they have specified the yoga exercises and the specific postural modifications that you can do. So go on to the iMumz app and look into that. You have twin pregnancies, so you just have to be careful about weight bearing, about balancing yourself while walking and things like that. But if the placentas are anterior and posterior, they are definitely the uncomplicated variety of twin pregnancies, that is the dichorionic twin pregnancies, and the outcomes will be good. So look up the iMumz app. I'm sure Ravi will be able to help you in case you want to navigate to some a region there. And there is an area for yoga in pregnancy. So look up those exercises and do the ones which you are able to do them under guidance. I have an MCDA twin pregnancy, okay, and it is my 33 weeks running. What should I do to gain baby's weight, and which week will be okay for delivery? That not to take help of NICU. Now, if you have an uncomplicated MCDA pregnancy, MCDA means monochorionic diamniotic. That means there's only one placenta, but babies are in two different sacs. And if you've reached 33 weeks without any complications, good for you. It's a very good thing actually, because 15% of monochorionic diamniotic pregnancies can have problems like twin to twin transfusion and growth discordance. But with your letter, I'm assuming that these problems are not there, which is extremely good. And if you have reached 33 weeks, your doctor will take a call at 36 weeks. For monochorionic diamniotic pregnancies, after 36 weeks, we can take a call. If there are still no complications and she wants to wait till 37 weeks, then that's also acceptable. But I think the first call will be at 36 weeks for an uncomplicated condition. Suppose there are some complications like, Doppler abnormalities or growth abnormalities in the baby, then depends on SOS, that decision has to be taken. If you reach up to 36 weeks or 37 weeks without any problems, maybe the babies won't need to go into NICU, but that decision again will happen after the babies are born. So if you're given a choice, go to 37 weeks. If there is some slightest doubt before 37 weeks, then 36 weeks is good enough. My cervical length is 3.2. If it is 3.2, that should be good. That is, anything less than 2.5 is worrisome. 3.2 seems to be good. So that should be reassuring. I'm 10 weeks pregnant. If I stand for prolonged period, I have pain in my pelvis. Okay. So try to avoid standing for a prolonged period and take rest. Like it said, pregnant ladies need to rest 2 hours in the day and 8 hours in the night. And even after that, if you have pain, then you need to see the doctor, because at 10 weeks, we do not expect the pressure of the pregnancy to be causing pain. At 30 weeks, if you said that, I would say, okay, maybe it's the physical pressure. But at 10 weeks, having pelvic pain, get your urine examination done, rule out urine infection. And if it continues, then probably you need to see, maybe you have an orthopedic reason for pain. At night, my babies come to the center place of my tummy, which feels very painful, and I'm unable to get up. My tummy is in round shape. Is it okay? Well, Rajni, these symptoms do happen. Every woman has a different perception of where the babies are. And because, sometimes you have the back towards you don't feel the movements that much. Sometimes the limbs are towards you and you feel the movements a lot. So, um, all these are known symptoms. I can't say one way or the other, but and in the night you are actually paying a lot of attention. The whole day you're busy with a lot of work and you don't pay attention. At night, your entire focus is on your babies. So you feel their movements much more, you perceive their position much more. So these are all accepted things. And if the pain is not persistent, if there's no discomfort which is unbearable, then it's kind of acceptable. So I would say enjoy the movements when you feel them. And these are part and parcel of pregnancy symptoms. Just learn to enjoy them. I am 18 weeks pregnant and type 2 diabetic with HbA1c of 6.2. I have also started taking tablet Lobet for BP now. Is it possible for me to have a normal delivery? Okay. It's a long journey now. You're 18 weeks pregnant. and you are type 2 diabetic with not very good control because HbA1c is 6.2. So like I said, it's a long journey with diabetes and hypertension. Your doctor has to maneuver too many things. She has to make sure that your blood pressure remains under control. She has to make sure your sugars remain under control, and the interventions that will be done for all this may affect the growth of the baby, but she has to also ensure that the baby grows well. Despite all measures, sometimes the babies don't grow very well, or they grow too big or too small. So with that entire picture in place, if you reach 37 weeks of pregnancy without any complications, with an average grown baby, then the decision is about inducing labor for delivery, or doing a cesarean section. So that will all depend on how you are. You've already started taking medication for blood pressures. So if the blood pressures become uncontrolled and we have to deliver you at some point before 37 weeks, it's very unlikely that we'll be able to give you a very safe vaginal delivery. Whenever it is possible, see, as obstetricians, that is kind of our goal, isn't it? A cesarean section is a surgical procedure. We don't think that is the first thing in our mind when we want to take care of pregnant women. Vaginal delivery, or a normal delivery that you say, that is a success for an obstetrician as well. So whenever it is possible, it would be the first thing on our chart. But if it is not possible to ensure a vaginal delivery, given the complications of the mother or the complications of the baby, we may have to resort to a cesarean section. And this decision, as I said earlier, will be taken at the time of delivery. There are conditions where we cannot allow for a normal delivery. For example, if the placenta is completely covering the neck of the womb, a woman who's had previous 3 cesarean sections, or when there are more than 3 babies inside the womb, and we don't think we can effect a normal delivery safely. In those conditions, we can tell you well in advance that, look, whenever you will have a delivery, you'll have a cesarean section. But these conditions, like when you are 18 weeks pregnant, but you have uncontrolled diabetes and hypertension, okay, if things get controlled and you reach full term and you are up to it and baby's up to it, we can try for a normal delivery. But it's too premature to kind of write down that yes, you will have a normal delivery, or yes, you will have a cesarean section. It's unfair on you as well as your doctor at this moment. So take it as it comes. Try your best to keep your sugars under control. Try your best to keep your blood pressure under control. Keep track of the baby's movement. Keep yourself positively motivated, and then I hope you end up in a full-term pregnancy where you're considering normal delivery. And if you actually have a normal delivery, then congratulations. I am 16 weeks pregnant. I have cough and cold. Can I take Himalaya coughlette syrup? I think it is over-the-counter medication and safe in pregnant women. But as a general rule, let me tell you, look at the product and see if there is a specific warning given to pregnant women. If that is not given, then you can take it. Having said that, no self-medication in pregnancy. Yes, Himalaya coughlette syrup you mentioned specifically, and that is a Ayurvedic preparation where I mean it's not unsafe for pregnant women, so it can be taken. But again, if it doesn't, suppose your cough and cold doesn't get better in 1 or 2 days, you definitely need to see the doctor, because you don't know what is the cause. And over-the-counter cough syrup can handle a part of those problems, but some of these problems might need more intensive medical attention, and therefore take it, but don't overdo it. If the symptom is not going with that, that means that's not the right form of treatment. You need something else. I am 9 weeks pregnant and my doctor has not suggested any scan till now. Is it fine? I'm also B negative and my husband is A positive. Should we take any extra care and medication? Okay, Manasa, you seem to be very enlightened about a lot of issues in pregnancy. That's good. You being rhesus negative and your husband being rhesus positive can be an issue sometimes, usually not in the first pregnancy. I'm assuming this is your first pregnancy. So one baseline test that we advise everyone who's rhesus negative is called an indirect Coombs test, ICT. So get an indirect wombs test and expect the result to be negative. Negative is good. If it is positive, then you need to meet your doctor urgently. But if it is negative, that's very good. And that's a baseline assessment of antibodies. Till 9 weeks, you've not had any scan. I mean, uh, I would think it's a good idea to get a scan done to make sure that your pregnancy is intrauterine. So if your doctor's even done a bedside assessment and seen that it is an intrauterine sac, then that's fine. If that has not been done, then get one done in this stage to just check that your pregnancy is intrauterine, that you have just one baby, and the heartbeat of the baby is fine. One baseline scan can be done between 6 to 8 weeks of pregnancy, which is known as a viability scan. Maybe your doctor's been a little cautious considering the situation right now in the country, and because of the pandemic we are kind of holding on to very very essential assessments. But since you've asked about this question, it may be a good idea to get a viability scan done and make sure that things are going fine with your pregnancy.
Yeah. Doctor, we
um,
have some questions inside the iMumz app. Shall we take?
okay. Sure, Ravi.
Hello?
Yes.
So next question by Aarti. She's 27 weeks pregnant. The hemoglobin is 11 1 month back. She's worried about diabetes. Please suggest tests to check diabetes. And she's feeling swelling in the feet today. Is it a cause of worry?
Just tell me again. She has
Aarti,
diabetes.
no, she's concerned about diabetes. Her
She's
hemoglobin
concerned.
level, yeah, her hemoglobin level is 11, and she's having swelling in the feet today. She
How many
faced
weeks pregnant is she?
27.
27 weeks. Okay. So, Aarti, you said.
Yeah.
Okay, Aarti, your hemoglobin 11 is fine. I mean, that's acceptable. And continue with your supplements, because in the third trimester of pregnancy, the baby's iron requirements also increase. So, if the baby doesn't get enough, it will siphon off from you. So, you should continue your iron supplements to maintain it at 11, or maybe even 12 is even better, but 11 is fine. Now, you are concerned about diabetes. You should be, because in India, the incidence of gestational diabetes is pretty high. And most of the doctors will advise you a screening test for gestational diabetes in pregnancy. Different units use different protocols. Some people do the screening with one test, some people do with the other. But if you are concerned, I would suggest you talk to your doctor directly and ask her for a screening test. So, usually, it's a glucose tolerance test, which they do between 26 and 28 weeks of pregnancy, and that test will let you know whether or not you have what is called as gestational diabetes. So if the values are abnormal, then also you need not panic, because in pregnancy it's very very common, especially in India it's very common. And whatever this gestational diabetes, most of it will resolve after pregnancy. If at all your values come high, then you will be asked to have a diet modification. If diet modification can control your sugars, then that's excellent. If it does not, then probably you'll need some medication and maybe even insulin, but that's later on. These are all because you asked, you are concerned about diabetes. I'm not saying you'll actually need them. So take it as it comes. The other thing you asked was regarding swelling on your feet. Now, that's a very, very common symptom of pregnancy in general, because what happens in pregnancy is your gravid uterus, or that womb which is much bigger, which houses a baby now, it puts pressure on your veins, the veins that come back from the feet. And the veins have very thin walls, and because there's a pressure on them, the return of blood, the blood flow that returns back to the heart, gets little impeded. And because of that stagnation of blood there, you tend to have swelling on the feet. So what is required is, whenever you sit, if it is possible, use a footstool. Avoid hanging your feet and sitting. Avoid standing for prolonged periods. So you tend to raise your legs when you sleep. You tend to put a pillow under your legs, so that they are elevated, and just by the position there will be some augmentation of the venous return. The other thing you can do is put a footstool while you're sitting, and keep moving your ankles while you're sleeping, so that your calf muscles are active. Mild walks also help, because your calf muscles are like the heart in your legs, which push the blood flow back. But to avoid that pressure, you need to do this. Don't lie back straight on your back. Lie to a side, and if possible, elevate your legs and see that. The other thing is water retention due to the kind of diet that you're taking. If you have a very salty, spicy diet, you tend to retain more water. So avoid that kind of a diet. Eat a normal, healthy, balanced diet, not too much, lots of pickles, lots of chutneys. They tend to have a lot of salt, and that causes water retention. So avoid anything that causes water retention. And despite everything, if it continues, then you get a blood test and urine test done. If you are excreting a lot of protein from the urine, also you may have swelling, and that is important. That for that thing you will need specific concern and specific guidance from a doctor. Check your blood pressures, make sure they are also normal. So if there's no other symptom with it, it's a common thing in pregnancy. But if you have high blood pressure, if you are losing protein in your urine, then you need to see the doctor and they need to give you advice regarding that swelling.
Thank you so much, Doctor. Nagamanasa has a question. She is 9 weeks pregnant. The doctor did not suggest for scan until now. Is it fine?
I
She's
think
also.
I've answered. No, I've answered that question. She's B negative and husband is A positive.
Yeah,
And
yeah. So sorry.
I
Yeah,
just
I
answered
just
the
noticed.
question,
Right,
Manasa,
right.
because she
Yeah,
also put it on the chat.
yeah. I just noticed this.
No
Thank you, madam,
problem.
for the claiming. Damani has a question. She's 34 weeks pregnant and she's feeling little jerky movements 2 to 3 times a day. It's like hiccups. It is for 5 months continuously. Is it okay?
Okay. So Damani, like I told you, we as doctors sometimes we are amused that every woman describes the baby's movement in a different way. Now, some people say they're kicking me, some people say boxing me, and now you said they are like hiccups. So, your perception of movement of every woman is very different, and there is no one correct way of perceiving it. Now, what I would suggest is you are at 34 weeks pregnancy. What I would suggest is you start timing and counting the movements in a systematic manner. You make a chart, put three vertical lines after breakfast, after dinner, after lunch, and after dinner. So after every major meal, lie down on your bed for like 1 hour. Lie on your left side. Don't watch TV. Don't talk to other people. Just keep noting down how many times the baby moves. So if you are noting 3 to 5 movements in that 1 hour after meals, that's enough. Okay. After that, whatever the baby does, let the baby do. You relax. So count it regularly. If you're feeling that many movements in your waking hours, 1 hour after breakfast, 1 hour after lunch, 1 hour after dinner, it should be enough. So uh, these jerky movements off and on 5 minutes, like they are all normal. So you start counting your movements systematically, you will also feel relieved. And then if you don't feel movements in that, suppose you don't even feel two movements in that whole hour, try drinking something warm and trying again. And if it doesn't, if the movements are definitely less, like you counted yesterday it was good but today it is not uh, moving at all, and you're really worried about it, then visit the doctor. They will check the heartbeat, they might do a CTG, and they might, because at 34 weeks you have to be little sort of on guard about the fetal movements. What you're perceiving, I would classify it as normal.
Yeah. Thank you so much, doctor. Next question by Madhvi. She's 13 weeks pregnant. Her doctor advised her few tests like rubella and dual test. After ultrasound, are these tests really necessary if she's feeling perfectly fine and normal? She got ultrasound done in second month and it was perfect.
Okay, you are feeling perfectly fine and normal, which is excellent, isn't it? Now, the purpose of doing an ultrasound is to check how is the baby inside. You need to also know whether the baby is feeling fine and normal inside. And when we talk about normal, there are things in the baby that we can perceive when the mother perceives movements, but then a structural assessment of the baby is very necessary. 13 weeks is a time when the baby would have formed its head, hands, legs, the heart would have taken shape. And there is a very important marker of fluid behind the neck called the nuchal translucency, which is an important marker for chromosome abnormalities. So, all these things can be assessed in the 11 to 14 week scan. Hence, your doctors address that scan for you. The other thing is the dual marker test that again measures two chemicals, the beta HCG and PAPA, which complement your scan in assessing the risk for chromosome abnormalities. And this first trimester screening is a very, very important screen. See, I see lots of women with fetal complaints in the second trimester. Suppose you have an echogenic intracardiac focus, a very small marker in the second trimester scan, and you've had a good first trimester NT scan and dual marker test, which has given you a low risk for chromosome problems. We are very reassured later. But suppose you've not had the first trimester screening, then even small markers in the next scan can cause a lot of problems. So I think a doctor will not advise you tests that she doesn't think is necessary, isn't it? Why are we advising tests? We are advising tests because we want certain things to be done at certain periods in time. So if she's asked you, please go ahead and do the test. Also, whenever a doctor tells you that a test has to be done, discuss it with her. See, in doctor patient relationship, this constant communication and interaction is very important. One doctor has asked you to do the test. Why do you have a doubt? So check it with her. Madam, why do I need to do this? I'm feeling okay, still do I need to do this? Then she would have told you exactly why you need to do it. Because when we check you, we can only check you. For the baby, we need to do an ultrasound to check. We can't keep on doing ultrasounds every time. So we have specific time intervals when we do ultrasounds to get specific information about the baby at that stage in pregnancy. So yes, a double marker test and a first trimester scan in 11 to 14-week period is an important test and must be done. Okay.
Thank you so much, Doctor. One more
Um,
we take from iMumz app before we take more questions. The question from Manisha. She's 15 weeks pregnant and she's feeling mild cramping on the right side of her stomach. Also, she's not able to take calcium tablets as calcium tablets is causing nausea. Any alternative? She's asking.
Okay, this cramping part you will have to see. See, cramps are common in pregnancy, but again, we cannot neglect them completely. So, drink a lot of water, make sure you are very well hydrated. Check your urine infection status if there is any urine infection, and if and see that your bowel movements are normal. Because if all these are fine, then why would you have persistent cramps? So, check all this and address the cramps issue. If still it persists, get a checkup done by a doctor to check the cervical length, because I'm a little worried about the persistent cramp on the left side, right side of the abdomen. It needs to be addressed. The other thing is calcium. If you think the particular calcium is causing problems, try changing the brand. Go see your doctor and she may replace it with a syrup, or she may replace the brand of that calcium, and see if that helps. Because everything said and done, iron and calcium supplementation in pregnancy is worthwhile. So giving it up completely is not a good idea. Suppose you cannot tolerate calcium at all, whatever preparation is given to you, you are unable to tolerate it, and instead of that, you are having pain and cramps and vomiting. Then what you do is increase the amount of milk that you're taking in your diet. Some dairy products, you increase that in your diet, and try to, you can take some ragi and some, some diets. You can meet a dietitian and get a whole list of things that would be at least enriching the calcium in your regular diet. But really speaking, the amount of calcium and iron that can be given as a supplement tablet or a syrup, it's not really possible to get the entire thing through your diet alone. So see if you can change the preparation and get that. And if it's just not possible, then just modify your diet. That should be okay.
Yeah, you can take continuing questions which are there, Doctor.
Okay, I have two more questions, and one is Karishma says, I'm 31 and 10 weeks pregnant. My doctor has not recommended me Sustain SR. Should I take it? No, if she's not recommended, maybe you don't need it. Sustain SR is it's a medication which contains a hormone called progesterone, natural micronized progesterone, and that is given when we suspect deficiency and need to supplement it. So if the doctor feels it is not necessary, then I would go with whatever she feels. So it's not a like folic acid you must take in pregnancy, but other supplements depend on a case to case basis requirement. My due period date was 7th July. I took a test and got a positive UPT. Congratulations. And my beta HCG is 9. That's good. See, this level of beta HCG shows that you are pregnant, and your pregnancy test is positive, so that means you're going to be a mom. So I think just go get a scan done and check that the pregnancy is intrauterine and where it is in terms of your the gestational age, and then you can follow up the pregnancy with all these discussions that we've had at different stages. Different tests are needed, so it's a beginning of a whole long journey which will uh, lead you to motherhood throughout your life, and that's good. So congratulations, Jayita. And then thank you very much. Why elderly primary test is done? What is elderly primary test? I don't know, but we are worried about elderly primaries because we think that they would be at a little higher risk of fetal chromosomal abnormalities and some other complications because of their age. So there is no elderly primary test by definition. I'm unaware of anything like that, but I know that certain precautions have to be taken in women who are of an advanced age. The definition of advanced age changes as time changes. At one time 30 used to be high, then 35 used to be high. Now we know many women who postpone their pregnancies because they want to do more in their careers and education. So the tests are done because we anticipate certain problems, but having said that, most women at that age group also do well. What is the minimum level of hemoglobin required for delivery? I wish we could say that I will not deliver a woman less than 6 grams of hemoglobin, but that is not possible. Thank you, Jaideep ma'am. And that is not possible to do that, we have a minimum cutoff, because unfortunately there are some women who land up in severe anemia for various reasons. And sometimes a woman could have an acute hemorrhage and lose a lot of blood towards the time when she has to deliver. So ideally, we would like the hemoglobin of our woman to be more than 11 or at least more than 10. But if that is not possible, there are methods of addressing that anemia, and it can be by IV iron, it can be by blood transfusion, and if nothing works, then we have to take all precautions and do that delivery under very, very controlled circumstances with intensive backup from the physician. I think we've completed our 1 hour, Ravi. I still have time to take more patients.
We still have some questions, but unfortunately, we have to end our session here. There are some questions inside iMumz app also. Please post your questions in the feed section of iMumz app, and one of our experts will definitely try to answer them soon. And we are trying our best to answer all the questions. Thank you so much, everyone, for joining. And a special thanks to Dr. Chinmayee for joining and taking all the questions very patiently and giving out answers, and taking care of our all the doubts and concerns. Thank you so much for doing that, Dr.
Thank
Chinmayee.
you, Ravi. Always a pleasure. Thank you, Jaideep ma'am, for giving me this opportunity. Okay, so good luck with iMumz ma'am app, and I hope all of you use that app because it's a wonderful app. I mean, I look through it and it's just very carefully done. So congratulations.
Yeah. Thank you so much, Manasa, for commenting. Thank you so much. So many people are thanking you, Doctor. Tejal, sorry, we're out of time. Please post your question in the iMumz section, iMumz app, and we'll definitely try to answer. Thank you so much again. Have a great day, everyone. Bye, madam.
Thank you. Good evening. Bye-bye.